All right, welcome back to the show. What's best for the patient is best for business. And man, I got to tell you, when I came up with this title years ago, things have changed and things have changed quickly. Yet I still believe I've held true to the mantra. And as we move into this new, I don't know, it's not a new decade. We're moving into the future here with tech and software. I've been trying to get my guest CJ on for since I met her at the APTA Future of Rehab Summit. What month was that, CJ? Do you remember? About 5 months
July.
ago? July, yeah.
Yeah.
So it wasn't that long ago. Got to meet you in person. And I went because I wanted to hear what people are talking about, what people are saying, the users, some of the platforms. So I show up there, I meet CJ, tried to get her on the platform. Our schedules finally coincided to me being in Philly yesterday and now in California. So you get me up. This is good. I'll let CJ talk the whole time. And here's the other thing. This conversation, this needs to get timestamped. It's November, late November of 2025. And I do this because there's a couple conversations I'm having I want to go back to in like 3 or 4 years. And fresh off the hills of PPS that saw it, Paul Singh, I interviewed him this week. His podcast will be on before this, said it looked like a tech conference. And he comes from the tech world. And I had a bet, I'm going to keep sharing this. I had a bet with Mike Silva how many AI platforms, just doing anything. No, not platforms. How many AI booths there would be. I guessed way too low. I was like, oh yeah. And then we got there and I was like, it looks like a tech conference. So without further ado, I want to introduce CJ because she's going to share her journey. And I think this is going to be a conversation that everybody's going to need to listen to. So thanks for connecting. Thanks for making the time. I really appreciate it.
No, it's an honor to be here. I'm so excited to be here. So
Awesome.
hopefully I don't stumble over my words or say something above PG-13 or that
Well, you can wait. Let's get some clarity. My goal is to always have the E for explicit in front of every podcast. And I think there's like one that doesn't have it and I'm still disappointed, right? So I'll curse before it's over. So you feel free to say whatever you want. There are no rules here. That's why I told you, right? The structure at the beginning. There are no rules. I want people to hear from you, hear about your journey and just share your knowledge of what's going on again, as of November, 2025 in this, I'm going to say tech/AI space. So.
Yeah. Okay.
Awesome. Thank you.
So my journey started, I started at J&J, Johnson & Johnson. I was part of a global operations leadership development program. And so that's kind of a fancy way. J&J is great. It's kind of like the Yankees. They have a farming system. And so I started off in quality engineering, working for a med tech company doing insulin pumps. So class 3 FDA, technology, and worked through consumer. I was in supply chain, inventory management. I did, ideation and brainstorming, with Band-Aid. What else? I did, training for project management. What was great is that my first career before becoming a PT, I gained a lot of experience all through different facets of operations and different facets of consumer to med tech. Then, ironically, I decided that, as I'm doing quality engineering and quality control on a manufacturing line, I didn't like sitting behind a computer. And I say that with, as I'm here today, sitting behind a computer almost all the time. So I went back to school. I had loved anatomy. And in school, I got a very career-focused degree in biological anthropology and anatomy. I think my parents didn't know what I was doing, but basically I loved anatomy. I loved the human movement. So I went to PT school and at Thomas Jefferson, graduated in 2015. So it's been 10 years. Then from there, worked at Moss Rehab, which is a rehab hospital, top 10 in the nation in Philadelphia. I saw the implementation going from paper to EMR. there's so much tech in that rehab clinic as well. That was great. I got Graston certified and brought that in there. From there, I got burned out. I was a young professional. I was about to have my first kid, who's 6 now, and I couldn't think about all the documentation that I was doing. I was doing wheelchair clinic, talk about seeing technology that could help your patients and not being able to do anything about it. Um, but it, I couldn't go back to. I loved treating patients, but I couldn't go back to 12-hour days essentially. Um, and so then I went per diem. The pandemic hit. At the time when I was pregnant, I did a residency for orthopedic, for OCS. I got my OCS 2 days before the pandemic hit, and my daughter's first birthday was, I think, 1 day before the pandemic hit in 2020. So from there, um, the choices of the reality of it is health, childcare is expensive. And so do I work as a PT? And we all know PTs do not make that much money. And then do I have childcare? Do I do what I love, or do I be a mom? I had my second kid, and I lasted 3 months before I was like, I need to do something with my brain. So then I went into digital healthcare, and I became a PT for Hinge Health, which is great. I did evaluations. I saw the power of accessible care, and what that can bring to a patient. I saw the power of empowering my patients with my voice, and leading them through to heal themselves. And then from there, I was like, well, can I increase my circle of influence? Can I help more patients that I can see realistically as a PT? So I went to behind the scenes, and I was supporting the care team with chronic pain, at Hinge Health. And then from there, I went to quality, and kind of working to build a clinical quality program, the foundations of it, which was a great, great experience. Fast forward, I had 2 years under my belt with Hinge Health. They, IPO, which was fantastic. And I saw, as I'm talking and doing some of my volunteer work with the APTA, with the First Network, which is a member engagement group, as well as with the Academy of Leadership Innovation, seeing, technology being implemented without kind of that empathy with the workflow and what clinicians going through, continuing to see clinicians, being burnt out, and having this deep innate connection to being a physical therapist, and wanting to help solve problems. I think that's what we do. We solve problems. And decided to branch off on my own. So now I've started my own consulting business in September. The goal is, and my vision is, to see every provider augmented by technology that's sustainable, responsible, and works for them and with them. And yeah, and 2 months later, and it's so funny. In July, I would say, I love that you timestamped this, because when we think about these conversations with tech, and especially with AI, they're ever evolving. And I feel like every day I have my worldview is somewhat challenged and changed and updated. And if you're having a tough time with that, reading, it's called like, I have trouble with names. So it's basically like loving being wrong, and I've tried to embrace that too. It'll come to me at the end, so I'll bring it back.
Woo. See, I told you I'd come up with questions. Um, I want to just go higher level on a couple things I heard you say. The tech part and bringing the empathy and actually making sure the providers are I'm rephrasing what you said, so correct me if I'm wrong. I let you say it out loud. Making sure it augments, making sure the providers benefit from tech, is exactly right. And I think that's what we miss a lot. And I'm on this big kick because of a book I'm reading, by the way, which I should get royalties on. I swear to God, I've shared it so much. Called Reshuffle.
Oh,
Oh my Lord. Do you have it? Yeah, yeah, of course you do. Oh my God.
if you yeah,
It
there we
is this
go.
single, yeah, it's taken me so long to read. It's never taken me this long to read a book because of my notes, because of my going back to cross reference something. It's insane. And I'm enjoying reading it this slow, to be honest, where some books I'm like, this is too slow. I have to put it away.
Mm,
So because of all this, it's I'm going to look back on that book and go, thank God I found it when I did. Otherwise, I would have just been like swirling around going, wait, right. Or forget swirling around. I would have been chasing my own tail for a long time on this. And it really helped me to understand and ask better questions about where tech fits and AI fits and all this. Yet, I got to tell you what else it did. And I just want to set context. It also helped me to understand that it was the systems thinking
mhm,
of what I had to do in my own business. By the way, total coincidence, total luck. I had no idea what I was doing. But looking back and reflecting, now reading the book, it's helping me to better understand my journey, that was the right way to go. So again, I want to go back to this. What's best for the patient is best for business. And you could you could very well, like you were saying, you could replace what's best for the provider is best for business too, right? And I've had people challenge me on that, and I'm like, yeah, it's cool, but I said, bear with me, because my a number, like objective number one in my person journey, is to set the provider up for success, right? So back to what you're saying. So I'm constantly looking at this stuff and going, okay, how does this facilitate the person in front of the provider? By the way, which you so well addressed, whether it's in clinic, whether it's on a telehealth, whether it's on the phone, whether it's text, those are all in front of a provider.
mhm.
That's the other thing we gotta embrace. Right person. I used to say this all the time, and now I'm back. It totally
Yeah.
disappeared. Right person, right place, right time. And if we embraced what that truly means in this patient journey, then we would embrace some people need a phone call. Some people
Mhm.
need a telehealth visit. Some people need in clinic. But the value is understanding, in my world, how does the tech augment that? I keep saying, because in this space, everything's provider driven. And I'm like, I get it, but you understand we can focus on the provider by worrying about what happens before people get there. So
Mhm.
yeah, I just wanted to double down on all that. And I like the part about where you said, I get this all the time. Oh, you're not treating patients. Oh, you don't own your own business. I'm like, I'm impacting far more fucking people than I
Oh, you
ever
didn't hear
did.
me.
Right. And
Yeah.
so why do it's we are an interesting bunch, right? You've been in 15, 10.
T
Yeah, you got to triple that for this side of the podcast. 34. And it has that's never changed. It's always like, oh, you don't do this, you can't help me. And your world, this is the third thing I'm going to go, and then I'm going to stop talking. But these were all great things I loved hearing, is you starting your world outside of physical therapy, and where I came in, and I it was a mess for probably, especially the first 8 years of my business, all of that. And then I had to go get that education that you're talking about and then learn how to bring it back in. Right. So much value in that journey, in this mindset around, I can actually help more people. And then this tech enabled world of facilitating. Again, if you're facilitating what's best for the patient, then you're facilitating what's best for the provider. So I'm going to stop there. There's so much there to unpack. So you currently have your own business. I want to talk a little bit about this because I want to hear, based on your journey, what do you do? What's it called, and what are you doing in that business?
Well, it has a very unique name. It's CJM Strategic Consulting.
Oh, hold on. CJM. Oh, okay, all right.
Yeah, yeah. Um,
But
and
those are good, right? You have solid initials to put in front. Everybody's like trying to figure out what it means, right?
yeah, I mean, I wish I had the creative mind to come up with something really,
No, I think it's
really
good.
cool.
I
But
think it's
like,
good. There's strong initials in front of
yeah,
something, right? It's
yeah.
consulting and everybody. Yeah.
But what I want to do is, I've seen the power of having whoever's on the front line, whether that was in manufacturing, and this is a very lean Six Sigma type of perspective, but I've seen the power of having who will be doing the workflow come in at the
Oh God,
beginning.
no, no, you can't do that.
Oh yeah, so and so or not, and then you like. And I've also seen the whiplash that happens when that doesn't happen, um and I've done a lot of projects through my career, both in PT clinic and J&J at Hinge Health. And I think when you invest the capital, time, and resources up front to really understanding, I mean, right now, my big thing is, can I understand the problem and the use case? Um, and really hound out what we are trying to solve, because then that's going to affect how we solve it and what we solve and what we use to solve it. And I think that, this hype, and I probably rode the wave, right, of like Gen AI is going to help everything. Just slap Chat GPT, slap Claude on it, and it'll work. But that's not really the case, especially in healthcare. The more specific that we can get with what problem we're trying to
Yeah,
solve,
yeah, that's what
and
I'm.
I take this from being a provider too.
Uh,
The specific patient in front of me is the problem I'm trying to solve. And I've seen the slot of my patient just had a total knee, so I'm just going to slot them into total knee rehab. But it's really a patient in front of you. And so the ability to get very specific with the problem, and then on the PT side, get very personalized with the care, is going to determine, what mediums, what vectors, how. And so I would say, like, you have the right patient at the right time, at the right place, with the right treatment, and then they have the right outcomes. And that right treatment is so important because all of those three things ahead of time that you said fall into place, and then you're able to personalize and be specific to the individual that's in front of you. And I think that's the true power of tech, and that's the vision I see in the future.
that's interesting. I'm just going to say this. That's what I'm trying to do, just further upstream. Swear to God. I mean, I had that conversation with a couple people this week, right? So how do we embrace this team approach to set the providers? I did a couple posts. I said if we embrace outside of the no, I said if we embrace the team approach to people getting better, then we'll find that the work we do before the patient is in front of the provider will then maximize all of it. We'll maximize the provider time, the patient time. Again, I believe the work and the energy, like you're saying, needs to go into this journey, not what's going to happen, not just building all this for the provider. I also like the second thing you said. You didn't say it this way. Oh my God. I forgot how you said it, but I like this idea of ask a better question. Are we asking the right question, right? So the
Yes.
problem being, so what problem do we need solved?
Hmm.
And just as a quick example, I always like to say, people say, can you help me manage cancels? And I'm like, no, but I can help you prevent cancels. I'm like, isn't that the question? Right. Stuff like that. Yeah. Yeah. Yeah.
Yeah.
Yeah. Yeah. So tell me, yeah. So let's build on what you just said. So you're helping people understand that and how to implement into their businesses or with their tools, or well, who are you helping with this? The platforms, the providers, the all the above, the centers?
Yeah, my specific focus wants to be to help startup and early scale up healthcare tech
Yeah.
companies.
Yeah.
Um, and the reason why, I mean, you're talking about moving things upstream, right? That's upstream. Um, I had come from a background where, and I was joking with someone earlier this week on this, like I have this I don't know. There's I have a love of compliance, and probably should have been a lawyer, but I'm a PT. Um,
It's probably a good mix, by the way, right?
it
Especially
could be.
today.
I
It
think if
always
I
was. It always was, but especially today with right with tech and how do we use it properly, right? So
com-
that it's compliant.
completely. Yeah, and, although I think if I told my husband that I wanted to go back to school, there would be some,
Yeah.
there would be some partnership challenges
Yeah, after
there.
that journey I
Um,
heard, yeah.
so but, what's what's really cool right now and what I'm really enjoying is, I love acquiring knowledge, and it's so easy to do so now than ever before, to acquire knowledge and then to pick out which knowledge is the right one. Now, it's very easy. I'm going to put my public service announcement out. It's very easy just to go to ChatGPT or Claude or Gemini and be like, "Here's my question. I want you to answer it for me." But there, there's also the challenge of with knowledge being so in front of you, and this comes with this would be relevant in healthcare, right? As we start to automate care, as we start to have clinical decision support tools, as we start to have more things come up in front of us as clinicians, it's so much more important to continue to hone our craft, be expert clinicians, and be critical thinkers in that space as well. So, a lot of what I do, even though I don't see patients, is very similar to what I would imagine a
Yeah,
PT
right,
needs to
yeah.
do today.
Yeah,
Yeah.
that's interesting. So really, yeah, right. You could be here. Let's just go 5 years ago. Let's say 5 years ago, you could be walking into a clinic and doing chart reviews and doing the same thing. Correct? Looking right. Yeah, that's so interesting. Now, thank God. By the way, I'm going to say thank God we're looking at how to do that earlier, not because that's
Yes.
right. That's reactive. I like this word reactive versus proactive. Also, I think
Because
we confuse the work we do and what is reactive and what is actually proactive. And that's been our whole journey with the word prevention and all this other stuff. Yeah. You know, it's interesting. I'm going to reference this for what you just said, CJ, that exact statement about the knowledge and everything. That's chapter 5 in Reshuffle. So anybody reading Reshuffle, I was going to do a post. If you bought that book and ripped out chapter 5 and didn't read any of the rest of the book, it applies to physical therapy perfectly about what's our responsibility, right? What is our responsibility and where is our superpower? I'm going to say going into this new world. And it's what you just said. So is, is, is this evaluation of knowledge, shall we call it? I know that's not the word he uses, but yeah, it's
I'm
good. It's
not
going
there
to
yet.
be
I think I'm
interesting.
on.
And it's been hard, right? I'm manually trained. I'm 34 years out, all this stuff. And I'm like, by the way, let's say this out loud. November 2025. So I land. It's like 3 a.m. East Coast, 12 midnight California. The first thing I did on my phone was reply to a LinkedIn post about robots doing massage, right? Posted by someone. Well, and it was good, really solid post. All I replied was, saw a friend post about it on Facebook, 50 minutes. He loved it, said he would do it again. I go, we maybe need to think a little differently about this stuff, right?
Man, I didn't see that post on robots doing massage. That's interesting.
I've seen the machine. And
Okay.
then I open up Facebook and literally as I was reading the post without seeing the picture, I thought he was just talking about going to the gym and getting a massage before his workout. Literally, he didn't say a robot did it. It was weird. I
Interesting.
didn't see the photo, the video. And so I'm reading and I was like, just someone sharing again their day. And then I scanned down. I was like, oh, damn. And it was the robot doing the massage and he loved it. 50 minutes. Right. So this wasn't some cursory thing. So it was pretty interesting.
And what's interesting is, I actually remember being in PT school, and so at Jefferson, you do a massage class, and
Yeah. So do we.
and the highlight is the connection that you have from human to human.
That's what the
Um,
post, by the way.
yeah.
By the way, I'm going to give him a shout out. Ari
Okay.
Ginsberg on LinkedIn. I'd look him up. He's done a lot of great work and a lot of background on communication and all this. And that's what he's highlighting in the post. But the robot can't do this. It was like, you're correct. Yet, so do we just extract the value out and disconnect? I don't know. That's for another day. I'm not going to
Yeah.
say that.
Oh, no,
But he raises all those, CJ.
I love that. I have to look it up now.
Yeah.
Um, there's always so, there's always I'm the type of person that has about 40 tabs open. So it's
40.
like Yeah, like,
You
I
know
mean,
what,
okay, this
dude?
is something
I
I
got
wanna look at
70
later.
in this on this window alone, and I got 5 more down below. Catch up. Come on now.
Oh,
And they're
man,
all
okay,
important,
so
by the way. They're all
I
very
thought
important.
I thought I was a master at having way too many tabs open, and I'm looking at the legendary expert here. But it's one of those things where I'm like, "Oh, that's so interesting. I don't have time right now, but I wanna learn it
Well,
later."
and then I'll click on an article. So a lot of
Yeah.
times I had to create a right. So I have a folder on my desk. So because I'd lose things, I'd go back in the article, it'd be gone. So now I just dump them in there and try to categorize them and stay caught up. Um, Yet let me go back. I don't think I digress because I think it's important after 34 years where tech fits in. No, no, no. Let's go back even a step further. Where are we with the ability? Because I read these things about AI scribes, right? And then I think about what's out there, and people are more worried about the time and the hallucinations and having to review that. But I'm like, but that's where our expertise is because even if we wrote it, we should be reviewing it and reflecting. So where are we in this ability for it to really tell us what the next step should be in a journey, right? What do you think? Or really in telling us red flags, yellow flags. So those are like two different questions. It's ability to tell us like red flag, yellow flags. But then I think the bigger one is really what is the next step? Because that's where the reasoning and the knowledge comes in, right?
Yeah, and in terms of are we ready? I've been thinking about that. So, when we think about when I think about going back to the right patient, right time, right place, that's around access. Are we bringing in the patient to sit in front of me as a PT that needs a PT, but not only that, that needs my expertise. And if I had stayed in the clinic, my what I wanted my niche to be was orthopedic injuries in a chronic neuro population. So, um, and so am I the right provider type? Am I the right provider? And then from there, when we start thinking about how we document now, I, we document now in order to get paid. Um
Thanks
and
for saying that before I had to.
yeah. And so I mean, there's so much, and I know like a big thing with you, Jerry, is helping the admin. So all the framework around which a clinician needs to survive and actually be human with their patient, that is what's compressing that humanity. And so the more we open up space to allow a clinician to be human, which is why we became a clinician in the first place, right? We didn't go into healthcare because, oh, I love documentation. And no, I wanted to sit and help heal people with my hands. Um, then I went to digital space and now I help heal people with my voice. And so but the bottom line, I just wanted to help heal people. And so, and I think, that's even too focused and biased because I think PT can also help prevent or keep people healthy. And my big thing is we have this whole thing about do no harm, but we're losing the focus on actively and proactively doing good. Right. So, and hopefully I will remember the original question. But so we have we have the right patient sitting in front of me. And now I'm able to be human because I don't have to worry about documenting. Now, some of that humanity might be, depending on how much you want to use the ambient listening, right? So, all right, you're doing 12 reps of, just extending your leg. And some of that is kind of like you get that robot type of feeling. But now the mix is I don't have to remember to write. And we know we can't multitask, right? We task shift, right? So if I'm sitting in front of a patient and I ask them a question like, what brings you in today? And they start telling me, and now I'm typing, it's very hard. We're doing micro shifts in task. We're not truly listening. We're not truly sitting in front of them. We're not being human in front of a patient. So now we have an ambient listening technology, and there's like over 60 of them out there, and there's a lot of different options out there, and they're more and more being developed each day because there's such like it's such an it's such a needed thing, right? Because if we have more humanity in healthcare, now we're not necessarily documenting to get paid because what we do will be captured. So we're going to get paid for what we do. And perhaps, some of these things, oh, healthcare expenses are going to go up. And I'm like, yeah, because we're going to capture things that we're doing that we might forget or not think about, because humans go into habits, and that habit, and I'm not a psychologist, but I'm really fascinated about like habits and, getting into ruts. And, I would bill 90% of my patients would get 4 TEs, right? And that's about it. But I was doing a lot of other different things. Imagine all the education we provide now being captured. Um, and so we're going to see differences in billing because of the way that we're capturing our notes now. And we're going to see some, I mean, it sounds bad to see some healthcare costs go up, but it's more about like accurate. We're going to be more accurate now. And we're going to have documentation that perhaps is more reflective of the care that we are providing, not necessarily for just getting reimbursed for a specific code. We're going to see less of this copy, paste, pull through type of stuff, and maybe some individuality. So not only that, so when I think about, I love data, right? Data to me is my love language. It's and so, right now the data that we have in documentation is to get paid. Most of it's the same because it's pull through. Maybe it's a little tweaks here and there. But does it reflect the individual patient sitting in front of me? Probably not. And then if we think about historical data from a healthcare perspective, it's extremely biased. We think about ethnic, and disparities and disparaged populations. And I know I didn't use person first language with that, so I'm going to apologize. But when we think about the different populations in which true healthcare has been provided versus sick care has been, and sickness has been amended, there's so much varied levels out there that we need to level that, and we need to bring up, the populations that haven't gotten the best healthcare to the level of providing healthcare, and we don't have the documentation right now. So when you think about what's the next best action, or providing good clinical decision supports, or even like having a drafted algorithm for a treatment plan, I don't think we have the right documentation in order to do that really, really well. And we're holding AI at a very high standard, right? Humans are fallible. I mean, if I don't have my coffee in the morning and I read something, and I have my coffee in the morning and I read that same thing, I'm probably going to get some different things. And I'm just one person. And now we're talking about multiple providers. And, AI in itself is that probabilistic type of nature that kind of simulates different people or different me's with or without coffee. So all of that to say, and to summarize it up, is right now the data that we have is in order to get paid. It's okay, I'm going to justify the CPT code that I'm using, and maybe I want to sprinkle in some medical necessity, maybe I'll sprinkle in some of my clinical decision, and I might show that, show that I am a doctorate of PT on the paper. But really, I just want to get paid because that keeps the lights on, and I can keep seeing patients, and then my little, like, I get compressed. I'm really hopeful and optimistic about ambient listening technologies opening that up, capturing more of what we do, creating immense amounts of data, which AI, by the way, can do free text, unstructured data analysis and then structure it for us. So that's another option too, right? And so now we have this documentation that actually reflects what we do as healthcare providers, and we're getting paid for it. And so then, and this is, I don't think this is tomorrow, and I don't think this is next year, but we have to build up these immense systems of databases in order to then have a very high accurate AI. Because when we think about, and this is my lateral thinking and tangential thinking, so stop me if you want me. But when we think about, when we have a value-based care model, right? And we think about the quality over cost, we have to then eventually get to the point where we're automating some like simple routine type of care. Because to me, the promise of AI in healthcare is to unload from a cognitive perspective, from a human perspective, the provider. And that starts, to your point, Jerry, all the way at the front and making sure that the patient sitting in front of me is the right patient that should be sitting in front of me. And they should be sitting in front of a PT, or should they be sitting in front of a psychologist? Because I blended my roles that way too. Or should they be going to PM&R and pain management? Or should they be doing both? And then how do I talk to each other? So ultimately, I think we start getting our documentation to reflect what we're doing and to reflect our value as healthcare providers. This is across all medicine, right? Stop just being for the purpose of getting paid, because that's the only thing we have time to do. Maybe the purpose of coordinating care, but start being what we're doing and how we're bringing value. And then we're going to start seeing some things fall into place around solutions and algorithmic treatment plans and automating some routine, simple aspects of care that we can provide. So then we can then focus on those complex patients that truly need our full attention.
So there's two parts in there. By the way, that answered my question. I want to, I don't know, clarify one thing or see if one thing fits in here. So this is interesting because right before that, my thing about our superpower is neck up. So, and I brought up that, right, people are worried about hallucinations. They don't want to have to review, right? Well, I'm going to argue you just stated why they have to review it, because we have to look at it. So again, I want to double down on what I said is, and this is really interesting. And so our job, and this is where I think the misunderstanding is 99%. Again, I heard it in what you said, so I'm just going to I'm going to probably rephrase it a little bit. This platform, our challenge, okay, I'm going to make a statement. Our challenge to us right now is we have an opportunity to build out the structure that then starts to grow and learn and become bigger and more encompassing if we do it properly. So if we turn it into another fucking system to a system billing, we fail the system. We fail it because it's our opportunity to go back and review and go, nope, this isn't right. Nope, we got to have this, because then that's what the system is going to put into it and then move forward and aggregate and aggregate. Am I correct? Well, yeah, you
No,
don't have to
yeah,
agree with
no, I
everything,
think I
but
agree.
right, you don't have to agree with everything I just said. Yet I keep going, and again, reshuffle. Our role going forward is going to be the one. It's going to be, I forget the exact terminology he uses, but it's a quality, it's a context, right? We become the context. We could become the context experts. And so it is our opportunity. And I'll tell you where I really learned this is when I put my front end process onto a platform. So I put my intake process into a platform. There's actually one clinic that I know for a fact is using the whole process. And I'm doing the quote unquote QA work. Let's just call it that. So that means I get on the phone and listen to it and listen for things. And the difference between day 1 and day 90 it wasn't huge, but man, if you were listening to it on day 1 and day 90, and even like my chat GPT, where I've been really specific, I use chat GPT 99% of the time. I close it off and it's just to search my stuff. So what I've seen, this institutional knowledge it built, right? And it's learning. Now it's making recommendations unsolicited based on my content, right? Or I'll say, write this up for me. And they'll say, do you want this and this? And you know what else I love? It'll give me sources. So it's not this random shit. It's like, and I'll go back and go, okay, what documents did they pull up from? So this whole learning thing at this point, November of 2025, being on the front end of this, instead of complaining that you have to review it and do it, I think you just perfectly laid out all of it of why we have to embrace this and go, thank you for this challenge. And I'm glad I'm on the front end because I'm going to make this a better fucking, and by the way, this a better system. I'm not talking about AI. I'm talking about physical therapy. I'm talking about getting people to the right place at the right time. That was really, yeah, people need to roll back your answer and sit through that whole thing, because that to me So much of our challenge right now is not look at it as a billing tool. Here's the other thing. It's not a fucking, it's not a point. This took me a while to move through. It's not a point solution,
Mm,
right? I'm getting all these people because I'm doing this. I'm using AI for benefit checks, and I'm using it for one reason and one reason only. It speeds it up.
mhm.
What goes in and what comes out is still the same exact shit. And I say shit because shit in, shit out. So my
Oh, yeah.
team I still have a team doing the whole damn work. Yet, again, we're training it, right? Yet it just speeds it up. That's all it is. I'm like, is there really value in getting this shit quicker? Between you and me, and I don't know when this is going to roll out. And it's my company and people are paying me. I'm like, in the long run, no, right? How do we do right? Where does benefit checks and auths and everything? How about right? Oh, Jerry, if we get rid of auths, your business will go under. And I'm like, well, that's not a bad thing, right? Because really, right, we're again, I'm bringing this back to how we view the current system and how we can. I'm constantly looking for ways to improve this
Mhm.
because I wrote an email to every one of my clients said we're going to AI for benefit checks. This will not improve the accuracy of the information. All caps, exclamation points, underline bolded was the next sentence. I'm like, this all it's doing is getting us the same information faster. So again,
Yeah.
back to the provider in the room with the patient now has an opportunity to, let's double back, ask better questions, right?
Mhm.
Lead, have, well, let's just say ask better questions, have better conversations, and then allow the system to go and know that, yes, your role is to take care of this person in front of you and doubly make sure it's correct on the other side because you're impacting the bigger system. Yeah, you just really filled my head up there. So yeah,
No,
so
and
I'll stop there.
no, and to your point, I don't think that we're ready. I think there's a misconception too, and perhaps this is too much soapbox, but there's human on the loop and there's human in the loop. And we're still at the stage where we need to keep
Yeah,
humans in the loop.
I keep saying
Um,
this. I'm like, I did a post real quick. I just do these posts where AI needs us more than we
yeah,
need it today, right? November 2025, that statement is 100% correct. It needs us, and we need to embrace this again as an opportunity, not as oh shit, because this will free us up. You defined it all.
yeah,
The payment, the everything else. By the way, I argue with we're increasing costs. There may be more costs associated further upstream, but the cost savings downstream is going to be insane. So I'm gonna disagree with there's more costs at that point, but overall to the system, CJ, I'm gonna say it's decreased. So it's actually a net, it's a plus, right?
yeah,
That's all. And I did want to throw that out there because I agree with you at that point, but our savings to the system, if we invest, if we put our energy and our knowledge into the systems, then we will end up, you and I both know, we stand to make more today in value-based care than we ever did fee for service. It's because of the
totally.
cost savings, right? So I just wanted to say that
Yeah.
part too.
And if you think about it, so and I'm glad you pointed out the cost perspective. So I recently read through the Office of Inspector General report on remote patient
Yeah,
monitoring, and
yeah, yeah.
remote patient monitoring went up 200%, right? And so if you think about it, like no shit. Of course it went up. It's a great technology and providers that are using it. Now, that report did show some
I read that
things.
too. I read that too. Unfortunately, it was a little too predictable, but I think there's a lot of good to take away from it.
Yeah,
Being
but also
predictable about what we'll do. Well,
yeah.
real quick. Yeah, I'll
Yeah,
let you
go ahead, go
finish.
ahead. No,
Go.
no, go ahead.
Well, I'm going to say, I think that report I think that's a warning shot to us. There's value here, but let's not turn it into fucking billing platform.
Yeah. No, and yeah, so, I'm gonna hold on to that,
Go.
and,
Yeah, that's all right. Go.
and then I'm also gonna say from a cost perspective, right,
Yeah,
that
yeah,
report
yeah.
was an idea of they looked at RPM codes,
Right.
and that is a cog in the whole system,
Yep.
and if to your point, yes, the whole system, if we might see increases in CPT codes that we're not using or increases in billing that were happening, but overall, from a time-based quality over cost, the cost is gonna go down because patients will get better faster.
Gotcha. Well, and
So,
also, I call it staying out of the system. I see
mhm,
RTM as staying out of the system, right? Just bear with me, the
okay.
current system. So if I communicate with you and go, how are you doing? And you're like, oh, I had pain with this exercise, and you correct it. And now they're like, yeah, this is way better. You just kept them out of the system.
Oh,
So, right,
yeah.
right. So I see RTM as almost like, I know it's part of the system, but it's further upstream. It keeps people from re-engaging, coming back in, going to acute care, going to the ER, going to their primary care doctor, going to their ortho doc, right? We can list off all the stuff that we know is going to drive cost up. So all that good stuff happens with it.
I'm pretty convinced, I'm like 80% convinced that my husband married me because I'm a PT and he's an adult athlete. So
That's
if
fucking
you think
awesome.
about that,
That is
right? And if you
awesome.
have that, you have that
Yeah.
family member
Yeah.
that you can call up and be like, oh man, my ankle hurts and there's a bruise. What can I do with that?
That's
And
RTM, right? That's
yeah,
RTM.
it's a it's someone you trust in your pocket to answer those questions, and then it gets to the point where you think about really upstream or even the circle, right? Now we're thinking about right patient, right time, right place, and now you have some an opportunity to talk to someone before you even go. Like, I don't know where to go. I would Google where to go. I'm a PT, and I'll be like, I don't know what to do. Let me Google where I need to go and find my provider. If I could talk to someone about which provider I should see, that helps so much. Um, and then, yes, and then if you think about just engaging, the movement to engage further with our health. And I'm not endorsed by any of, like, think about Peloton, Apple Watch, Aura Ring, Garmin, like, all the sensors that we have are allowing us to engage further with our health. And then you add in, Gen AI tools that, and I've done this. I talked about this, I think last week during a Con Ed course. Like, I've taken my anonymized genetic variant data that you get from like one of those
Oh,
you
yeah.
do genetic testing.
Yeah. Yeah.
And
Yeah.
I did
Yeah.
a blood test and I put them in and I said, look, um my daughter is 4, my youngest daughter is 4. I want to get better at, you know, um I want a PR on my FTP test. Let me just put it out that way. And so, I also have these like slightly irregularities with my blood tests. And here's my genetic, variant data. Tell me what I should do and what supplements that I could take. Because I don't want to take medicine. I just, if unless I have to. And it came up with that. And our patients are doing that. And just imagine that the power of that type of thing. Now, the conscious choice I always say that, you have to make before you do that is there is a chance that this can be used to train. There's a very small chance, or someone could be reviewing this, right? If you use one of the over the shelf type of Gen AI, very small chance. But ultimately, it's like that's the power of, now I know, what was it? It was like a B12 vitamin that I should take. And it was a specific type, I think it was like methylated, whatever.
Yeah. So,
And
yeah.
and I was like, okay, well, I can't take any B12 vitamin. I have to take one that's like methyl. And I,
For me. Yeah. For
yeah,
me, by the way.
exactly. Yeah. So that's the power of this. And then, I got my blood test. I love my doctor, a great relationship with her. But she called me 2 or 3 days after I got my blood test. And I was like, well, now I understand everything that's saying in there. And I'm just like, I know now I'm empowered if I had questions to ask her, with what questions to ask her. And so now it's like, not only am I right patient, right time, right place with my
Right
doctor in front of
information.
me,
How about,
right
right?
information, right questions that really matter to me as a patient. And then sometimes you have, those aren't quite as a PT that, had someone Google, what's going on with them. And,
Yeah. Well, they're low back pain. Hey, I heard this is best for low back pain. Oh, that's
yeah.
not what we do. By the way, that's the best thing you can do on the front end.
Mhm.
That's not what we do. Let me get you to the right place, right?
Yeah.
That's that other, yeah. Oh, well, I'm not going to go down that rabbit hole. But yeah, but we got to shift the mentality here and I'm going to double down on this. And I've said this a few times, but I really double down. If we don't truly understand our value in the system and we keep tying it to billing and we keep tying it to hands-on and we keep tying it to person physically, literally sitting across from us, all three of those, we lose.
Mhm.
If you choose just one of those, you still. So my whole world, I read a few years ago, business is risk management. That's all,
I like that. Yeah.
right? So that's it. So everything I do now, when I create a front end intake process, I go to the team and go, this will never be 100%. But
Yeah.
what we do is we want to decrease the risk of no shows, cancels, drop offs. So we want to increase the likelihood of arrival. How
Mhm.
can we do that? And I said, that's how we're going to structure this. So it's risk management. So if we look at those three things, well, if I eliminate one, I've decreased the risk. If I eliminate two, I've decreased the risk. And if I eliminate the third, then again, it's never 100% and it's never zero. But damn,
Mhm.
there's no way, right? And if 50, I I always say at 58, the cool thing is I get to bring the experience of none of this. I mean, no shit, grad school was no cell phones, no internet, right? Think
I
about
I
that.
will say I will say I remember I don't this is it. My husband is 47, 48,
I'm
and
58.
I turned 40 2 weeks ago, but I
Happy
remember
birthday.
having to look up, like
Welcome to the almost other side.
I know, I immediately was like, "Oh, I'm so tired." No, that was also because the whatever was going around this fall hit me during that time. But I remember looking up the Dewey Decimal System, but I also remember Googling something and peripherally learning about other things while I'm trying to focus on a research topic, right? And I think that's one of the big risks that we have right
Yeah,
now
right now,
is
right?
the
Yeah.
access to knowledge is so easy that we risk losing that peripheral um the
Yeah.
enjoyment of discovery, I
Yeah.
think that's,
I had
and
to
being
go
able
make a
to
copy of
absorb
a
some other
research
things.
paper, read the research paper, highlight the references, and then go back after I read the research paper and then look for the new reference paper.
Mhm.
I got on my phone yesterday to do something. It was that classic thing, one thing. Got on my phone, 10 minutes, put it down, realized I didn't do it, went back
Yep.
on it, fucking spent 15 minutes. And it took me like 35 minutes to complete a task that I'd went to do. And I laughed at myself and I went, Jesus Christ, right? And was anything else as of value in there? I don't know, but it was something I needed to do. And so, yeah, that stuff. Yeah. But,
Yeah.
you know, it's interesting because healthcare I want to double back because I still think this fits is, healthcare, you got to love the posts where people complain about people showing up and said, I Googled my diagnosis. And then healthcare providers or whatever you want to call them get all pissed off. It's like, God forbid your client, customer, patient come with a little freaking knowledge, right?
They
And,
they
you know,
wanna they're empowering themselves with
yeah. And,
knowledge, like
and I think there's a huge fear. I'll say any of this stuff out loud. There is a huge fear on I I just was told providers is a bad word. I don't really fucking care because we're all providers, but anybody with initials behind their name is what I'm going to say. Anybody
yeah.
with initials behind their name is having a hard time understanding where all this time, money, and energy we put into this, what value there is tomorrow. Because again, when we met, in July, things have changed. And I think if we spent a little more time reflecting on our superpowers, neck up, and not the hands, not the right, not the standing over someone and counting reps, not the greeting them in the waiting area, right? That's not the superpower, my friends, right? And if we embrace really, I say a lot of times in front of groups, my work here with your team and showing you how the front desk team empowers the providers and how that improves billing and how all this works together serves one purpose to allow the providers to be the experts you are. That's what I say.
Mhm.
I said, you're so bogged down in this other stuff. You keep trying to build up value, more treatments, more services, more equipment. I'm like, that's not it, man. That's not it. And we only serve like 10% of the people who can benefit from our help. You started this conversation out with access. So whenever I see anybody bashing online services or apps or anything like that, I'm like, the fuck, you afraid they're going to cut into your fucking 10%? We're all fighting for the same 10%. Give me a
Mhm.
break.
No, completely, and, you know, maybe this is my time to say something controversial, right? It's very easy to not try.
There you go.
So when we think about I went to school to be a physical therapist.
Yep.
and I went to school to become an expert in physical therapy, and
Mm-hmm.
then I did my residency, and then I got my OCS in order to become an expert in orthopedic clinical, physical therapy, and then, I all of that is a journey in order to focus on an expertise, but it takes hard work. It takes hard work to have I mean, I'm just gonna put it out there with an empathetic
Oh,
type of
yeah,
thing,
man.
but you
Yeah,
have 4 patients in front of you,
yeah,
and it takes hard work, and it's a big
absolutely.
cognitive load to have to personalize care for every single one of those 4
Yeah.
patients, but
But yeah,
they
that's what
really
we
need
owe
it.
the system, right? Yeah, they need it. We owe it to
They
them,
need
right?
it. Yeah, I was lucky to work in a clinic where I would have 1 or 2 patients an hour, so I feel I feel very privileged in that sense. It's so much easier to divert my cognitive attention and personalize care that way. But then but you see, like, we just get into ruts because it's easier to do that. We're having technology allow us to fall into automation. There is automation bias. There is de-skilling that can happen. There is this loss of our sense of expertise that is at real risk right now. And we have to take the proverbial stairs when there's an elevator and escalator in front of us. We preach that from a physical activity. We have to do that from a mental activity right now. And when we can, we need to really focus. And so one other thing that I would say is, because you mentioned reflecting on what we've done in our documentation as part of that reviewing, right? And I will be the first to say I've had to listen to myself do telehealth visits, and it is
Oh, brutal. Oh,
the
it's
most
brutal.
painful,
Yeah.
and I am highly critical. I suffer from imposter syndrome, all of that, and that spirals crazy. Um, but that is where growth happens. Growth doesn't happen by doing the same thing every single day. Growth happens by stepping out a little bit at a time, by becoming familiar with something and then integrating that in. And so doing something that's not familiar is where you're going to push your boundaries. And what's really funny is that we tell our patients to do that all the time. And, we're our worst patients. So, but we have to continue to take the stairs, especially
I
in
like
today's
that.
day and age.
I like that. Y- y- Right. I've been on this journey a long time. So as I tell everybody, I had a lot more time to reflect. I've made more mistakes than most people will make. I say, don't make my mistakes. Right. So the reflection part and the steps, I think, are, I'm just going to say, most valuable. Here's the cool thing in this whole journey, right? As I tell everybody, your superpower is neck up. It can't be the hands on. It can't be the standing over people. You want to know, when I reflect back, CJ, the single the single biggest impact on this whole, if you nailed me down to, tell me what is the one thing that's been consistent and got you to where you are today, and if I wouldn't have done it, probably would have taken a lot longer and I probably would have made more mistakes, is chapter 1 of the Maitland books.
Oh, really?
Chapter, yeah, no shit. So I go on, and by the way, for just for context for everybody, Maitland is a huge manual therapy guy, right? Manual therapy guru, right? Did all this stuff, right? They've undid most of his stuff that we claim to be changing, right? All these slides and glides and everything. And we know what the research says about manual therapy, knows where it benefit from.
Mhm.
And most of, just bear with me, most of Maitland's book, it does not talk about that stuff yet. Chapter 1, I've recommended people buy the book and read chapter 1 and put it away. He told us how to do a proper subjective exam. And if you go through and read that, CJ, it is how I've established. I'll challenge anybody. Go read chapter 1 and tell me my intake process for my front desk is not a Maitland approach. So that has been, so I want to challenge everybody in the expertise you've been building. It's not throw it all away, right? The reflection, the everything else. How did I acquire these skills? What made them better? What made them worse? Maitland has been Jeffrey Maitland, it's the single biggest impact. Chapter 1, subjective exam. He was literally the first one who ever said, ask him, if you ask the patient the right question, they will tell you the solution.
Yeah.
I'm like, I need that tattoo and it needs to be on my wall. It's actually not, but he was the first one who basically said, ask a better question. And
Yeah.
so, yeah. So as you unpack your journey and where you believe your expertise is and the imposter syndrome, we've all gone through it. I go through it regularly now. What the
Mhm.
fuck am I doing in a sales role, teaching people all this shit? I still reflect back on that stuff and go, right, that's the foundational work. Now, how can I leverage that to impact more people, right? So I want everybody to think about this journey of what you've done. And by the way, don't be afraid to throw all the bad experiences in there, because I'm going to tell you there, I can give you other stories where some of my bad experiences were my biggest takeaways that helped me to go, that's probably not the way we need to do this going forward, right?
Yep.
Yeah.
No, there's always an
Subjective
opportunity.
exam, Jeffrey Maitland. There's
Yeah.
my huge, right? And read that before you read the reshuffle book, because reshuffle will make a lot more sense if you understand how to talk to people and how to have a subjective exam is what an interview. It's whatever we want to call it, but it's just a good way to manage conversations is really what it is.
I love that. I will that's my homework. So that's gonna be my homework from today. Um, and start getting into reshuffle. And I referenced the book early on, and of course I thought about it. It's like that 3 a.m., right? Oh man, now I remember. Adam Grant's Think Again, is a really great book too. Um, Finding the joy in being wrong. And to your point, there's an opportunity to learn from everything and anyone. Um, I think when I reflect on my journey, it's like the what can I bring out from this conversation? What can I bring out from this interaction? I have, I'm sure we all have our patients that have brought something to the table, as well, positively and negatively. There's always an opportunity to learn and grow. Um, so yes, this is great.
I learned so much from those patients who sat across from me. I'd take them back. Hi, my name's Jerry. Right. I'm CJ. All right, CJ, right. I'm going to help you today. We talk about this low back pain. Let's go in the
Mhm.
exam room. All right, CJ, tell me why you're here today. Well, I don't know. My doctor told me to come. I learned so much, as God is my witness, as frustrated as I got. That impacts the way I've set up. So literally, I'll tell people, and I bring that up and I'll go, right, providers hate it. I'm like, there were times where I just like, oh, cool, we got 55 more minutes. I'm going to cut this off now. Let's just make it easy on both of us. I'll free up your time. I'm going to free up my time. And my goal is to not have people show up in the clinic saying that, right? So all of
Mhm.
this journey, and again, I've had more reps. Let's just say I've had more reps and more opportunities to reflect back and go, by the way, that was always difficult. And not only was it difficult for the provider, but I'm like, so the patient just invested a $50 copay. They took an hour off from work. They put their kid in daycare. So I'm like, how do you think it impacted them?
Yeah.
Right. So this whole thing about reflecting back and let's embrace all this stuff. And I really, man, my takeaway is we have, and you really brought this out, said it in the middle. We have an opportunity. I'm going to say it. One of my favorite movies ever is Matrix. We have an opportunity, and um, Chaudhry, I think I'm saying his name right for reshuffle. Chaudhry talks about the architecture, the architecture, the architecture.
Mhm.
We have the opportunity to be the architects
Yes.
again, and do not, because think about our current how we've morphed out. Do not become the frickin', I'm just going to say it out loud. Don't become the one person doing one task on the job. And this tech will allow us to become the architect if we stop looking at tech as a point solution, as a task. I refuse to talk about the tasks. I brought up the benefit checks, but I want to share it in a way that I understand what value it brings is speed. And
Yeah.
that's it. It's not doing anything else. It's same in, same out. I have a chance. And by the way, here's what else I've learned real quick on this, because I want PTs to know this. You need to go back to the AI scribes and go, I bring great value to you.
Mhm.
I want to sit down and talk to you about this scribe. I'm seeing these things. Take the lead. That allows you to be the architect. You know who's getting a huge raise in my company? Is the one managing the AI model, because I see the value. I got a call right after this. We have a call every week where my team lead comes on to talk to them, and they take all her ideas and put them back in the model. I'm like, wait a minute, who's in charge here? Who's right? We have the power in this. And she's getting a huge raise because, by the way, when she starts sharing stuff, I'm just like, no idea what she's talking about. So we talk about, oh, this will replace people. I'm like, she's getting a big raise. I fired nobody. I fired nobody when we brought this on. I restructured. I
Yeah.
restructured what people were doing because I like this. Chaudhry says this because the way we're doing business has changed. It has, I'm going to say it has little, I have to be aware of the task, but we didn't do it because we're changing tasks. And by the way, it wasn't reskilling. It was moving people around to where they had value in the system. And PTs have to embrace that. Oh, I got to review this. I'm like, do you understand the power you have right now? You're going to
Mhm.
impact what goes in and then therefore what that thing goes forward.
Yeah.
And all this is so new to me, CJ, right? And over the last 9 months, I've just been like, said, been drinking from the fire hose would be an understatement. But yeah,
But I
this,
also think that, when you reshuffle, I would say, or reshuffle or like move around, right? Um, you have to embrace it too. So I know you said, reskilling isn't what you're doing, but there is a level of embracing of that new value that you can bring. And
yeah.
so,
Now, hold on, just for context, real quick.
yeah,
I want to say this. What I don't want people to do is go, I do this now. So yeah, good for context here. I do this now. Now I have to learn how to do this. I'm going to tell you your knowledge and what you were doing in that other thing is all you're doing is shifting your knowledge, right? So
yeah,
I don't, you don't here. I got to say it. And my dad was a contractor, but it's not, oh, I'm an electrician. I got to go learn how to be a mason now. No, that's not what I'm talking about. Your skills as the electrician, right? You don't have to reskill into something new. I would
yeah,
say reevaluate how you've been doing your job and what tasks you are. This is that whole thing where Chaudhry talks about context, right? You become a
mhm,
context expert. That's
yes,
way different, right, than a task expert or something else, right? And
yeah,
and that's
upskilling.
the front desk. And this is what I'm training the front desk is you guys understand the process better than anybody. You can own this process if you don't look at this as tasks. I think the front desk people, like my lead for my benefit check team. Oh my God, she's going to be making more money than I ever thought we could pay her because she understood it and she just embraced it and started meeting with them. I brought her
Love
to
it.
the meetings, right?
Yeah.
And she's
And for
doing the
everybody,
same things, right? She's now leading, I should say.
hmm
Sorry. I'm
no,
thinking of this out loud and it's kind of unfolding as we think about it. So it's, yeah, embrace this, man. Embrace it and say, this is
mhm,
cool. I get to be part of this.
yeah. No, I think it's cool that I'm a part of this.
Yeah.
So I reflect on, where I was and what I was doing and, the fact that most of my journey has been saying yes to opportunities and then or trying just to have my foot in the door. Because the door will open a little bit further each time. Yeah.
And that ask better questions when I first and I'm sharing this because I think a lot of people are on the same journey I am versus how deep you were when you got here. And I really appreciate you sharing all this. But the foot in the door thing,
Mhm.
what I realized, I've spent most of my life telling people, oh, how good I am and what I can do for you. I realized with AI, if I did that, there was like no there. So I started going to the platforms and going, this is what I do. Is there any value to you in this? And then I just waited for the answer. And then I built out my next question. Right. And so that's where it's gotten, that questioning is what's gotten to me now, November 2025, going, okay, I bring some value here. I bring value there. But instead of going, hey, I do all these great things, you should work with me. I'm like, I do these three things. Is there any value to your platform? And going around and asking everybody the same question has really helped me to better understand, because really what I was trying to understand, do I have a role here or not? Because if not,
Yeah.
cool, but
Yeah.
at least I'm not going to keep fighting it. Right.
Yeah.
And then I'd go, okay, right. So how can I make sure and leverage all of this? It just, again, you could say it was personal and it was, I wanted to know if there was any value there. And if it was no, 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 then I'd figure out, okay, where do I fit in this new model? Right.
And it might be a no or it might be a not yet.
Yeah. And I think
Um,
PTs are going to be surprised. So let me double back. If you start asking where my value is in this, you're going to find out it's a lot higher. Your value is higher
Mhm.
than you may currently believe it is just someone reviewing charts. You're not, you're building the fucking system out.
Yeah, and I'm so glad you brought that back up, is that, I said it and I was like, "Man, I feel like I'm putting this whole weight of responsibility on, healthcare practitioners and PTs right now," but honestly, it's the opportunity to build something fucking
Oh,
fantastic, right?
huge.
It's
Yes.
like, this
Ginormous.
is the future, and, um, that we can really this is the power that we have in our hands. Um, and one of the things that one of the some advice that I got when I first started off on this like existential crisis of, oh my God, I'm gonna do okay, all right, I've quit my job. I have 2 kids. I have a house. Now I want to do my own thing. Um, and the thing that I got was, what the question, and such a great question, right? What brings you joy? And that's what I built my business on, is this brings me joy. And when I was a PT, being a PT brought me joy. And so can we bring more joy into what we're doing? Because then it doesn't feel like, I mean, so cliche, right? If you enjoy what you're doing, it doesn't feel like work. No, it's work sometimes, but at the same time, it's like there's a fulfillment that'll help to counter some of that burnout that we
Yeah,
all get
absolutely.
occasionally.
I love the way you just all shared that. By the way, if you love what you do, then you don't have to work, dot, 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 but you got to put in a shitload of work to get to the point that you don't have to work. How about that? How about
Yeah,
that? And I think that's what PTs are facing. So, oh, my joy is not documentation, but I'm like, yet if you leverage this opportunity right now to do a little bit of, because your expertise really is what goes into that. So
mhm,
again, this is part of, if your joy is helping these people and treating these people, then here's this great tool that if you commit some time and energy to it, will will return an ROI that's unmatched in my lifetime, by the way. There's been
exactly.
nothing I've sat across. I look at the, oh fuck, I don't want to go down this rabbit hole. I
I
look
know.
at the disjointed, well, let's go here. And Chaudhry talks about this over and over, the fragmentation and disjointedness of healthcare. We have an opportunity to connect it like it's never been connected.
Oh, isn't that amazing? Think about, like, I mean, just think about I think about my personal journey, right? When I was pregnant, I had my doctor in one health system, and I was lucky that she worked in that health system, which also had the hospital in which my
Yeah,
daughter
thank
was born.
God, right? Thank
That
God.
doesn't happen. Like, I mean, and then I was talking to my husband, who's an adult athlete. He plays volleyball. He sprained his ankle a year ago and had a really hard time about it. He's a high level athlete that is high performing, and it's not only just him going to PT, but he also had to go and undergo some like psychological type of
Yeah,
rehab as well.
yes, yeah.
And all of those providers being spread out so in siloed care. And I mean, you look at, yeah, it's the more we can connect and coordinate together, the better. I think we're heading that way. I think there's some regulatory movement to share data. I think there's some really great models out there. Mayo Clinic comes to mind, and I'm not, but
Yeah, I
um,
I talked to someone who's worked in that system yesterday, an AI
mhm.
platform, and wants to build some stuff out, and they come from the Mayo Clinic, and he kept telling me, "But that's not the norm. But that's not the norm." I said, "Yeah, I get it, man. Yeah."
So I mean, who
Hey,
who
hey, real
who
quick,
cares that it's
CJ.
not the
Yeah,
norm? Yeah.
I want to jump on this coordination word because don't wait. So here's again. Let's think about you. Who's ever listening? Your role. You have an opportunity. So this journey of coordinating things started in my own business, right? So I got tired. Here's another thing I learned in the research. So I'm trying to put together this patient journey that's seamless and coordinated. That I
Mhm.
called it connecting the dots, right? And so one of the things you read in the research is people hate paperwork in healthcare. I dug deeper. They don't hate paperwork. They hate not knowing they're going to have paperwork, and they hate repeating themselves. So guess
Mm,
what my front desk team did? I didn't do this. They auto populated this was like fucking 10 years ago. It was unheard of. So CJ walks in the door and they go, oh, by the way, CJ, here's your intake paperwork. Oh, by the way, this first sheet, we filled it with all the information you already shared, so you don't have to fill it out again. You want to talk about a differentiator, right? So you can coordinate, right? Yes, healthcare data, the big picture, but I'm going to challenge everybody to go, how can I coordinate? And I see it happening, by the way. Josh Funk
Mhm.
is doing this at R2P. A couple other people I know, Tyler down at Rise PT in Arkansas, they're all looking at this. How can I better coordinate and connect the dots in my patient's journey with the AI? And they're doing it, and they're going to stand out. And people are going to go back and tell your friends, you got to go see Rise PT. They're great. And that's all they're going to say.
Yeah.
And it's going to be because you fucking auto-filled their fucking paperwork.
Yeah.
This is the coordination we can do today, again, and lead from the front. Lead from the front. Again, give some feedback to that AI scribe and go, hey, you need my help. I want to meet with you weekly and share my takeaways. By the way, right?
Mhm.
I'm going to challenge PTs to go, hey, I'm a value add to this system. I want to meet with you weekly and give you feedback. And by the way, it's going to better match you and probably accelerate you, but it's going to help everybody else, including the people you serve. So maybe that's where I'd leave it right now.
Oh, well,
No,
let me
you
circle
go.
all the way. I'm going to circle all the way
Yep.
back to what you said
Go.
before around um, digital care, in-person care, phone call, messaging. Um, from there is, you have that expertise of saying, I want to see you one time a week, and this is what we're going to do. How does that, how do you want that meeting to happen? And what works best for your schedule? Is
Yeah.
the next great question too. And then you being able to utilize that. Cause then that is not only did that patient come in and not have to fill out their name 5, 6 times, very simplification, but you've asked them, you've expressed your expertise, you've demonstrated your clinical rigor, and now you've asked them what they prefer and how they get their treatment. And so you've concierged your service in such a way that meets the needs of the patient. Because some patients want to be able to come in 3 times a week. They like that environment. And some patients have, 2 kids and a full-time job, and the idea of trying to take time off work is just absolutely impossible.
I'm going to totally hijack this whole thing now because I've been doing all that. I brought that. I do exactly that. And CJ, you'll love my example I use. I say, okay, and I'll do this with the whole team in front of me. If we don't do that work, if we don't collect information beyond a diagnosis and fucking insurance and a date of birth, I said, you know, Becky has a 7:30 postpartum uh, patient on her schedule, low back pain, right? Another clinic, I'm going to use females, right? Because it's postpartum. Dr. Vicky, right? Dr. Becky has a 7:30 postpartum low back pain. And then I go through these 2 examples, single mom, right? Supported mom and everything, but none of that's collected. The
Mhm.
single mom ends up dropping off after 3 visits because Becky shows up 10 minutes late without any realization what's going on in any of those situations. And then what do? We blame the patient, right? And then
Yeah.
this person just continues on. But oh yeah, I knew she was going to drop off. She wasn't committed, and she was fully committed. It was just we didn't do the work we needed to do. That's the example I use, right?
Yeah.
Of why we need to do this work. I have SOPs, CJ, and I believe this is my value to the future. And I'm learning with the AI. I have SOPs about how to manage the first call, continue the conversation into the evaluation room without telling people how to treat, what to charge, and what their plan of care should look like. And then I have an SOP for continued course of care, including what you say to the patient before they walk out of the eval room, what the front desk then says to continue. I've got all the SOPs built out. Mind you, I did all of this before any of this shit survived. And now I'm realizing this is the gold mine
Yep.
because I've done right. And so how do we structure it so we know these things in case so, right? And not putting people on the schedule with what fits you because it's not going to serve anybody. No show, cancel, drop off. And then we're going to blame the patient. By the way, another big tell is people with a big old wait list, right?
Yeah.
I'm like, and I'll say this out loud. I challenge people that your wait list is almost unethical because people have raised their hand, said, I need your help. I
Mhm.
want to come in. And you say, cool, sit here. I'm like, you got to
Mhm.
send them somewhere else or find a solution. We can go down this rabbit hole, but most people leave them there. Why? So they can fill the fucking cancel, no show drop offs. And I'm like,
If they do that. if they
And
have a
then it's
good
just this, yeah.
system.
And then it's just this, well, I argue, why are people canceling, dropping off, and okay, right? So this whole thing, but yet with tech now, with RTM, I'm like, I had a great here, I'll give people this. I had a great interview with Anthony Moritato. He uses RTM to keep people off the wait list.
Yeah.
So get them started in their care, right? He shared how to do all that, right? And it's just brilliant, right? So all of this stuff you said, it's easy to bake into the models if we're thinking this way. What's important, right? What's important to this journey? And we only can do this if we take a step back and look at least freaking 15,000 foot. We're so far in the weeds, man. We're like staring at we're not even looking at the weeds. We're staring at the roots of the weeds. We got
Oh
to
yeah,
take a step
we're
back.
examining the grains of dirt
Yeah,
around
we
the weeds.
really are. And if we take a
Yeah.
step back and look at this bigger journey, and I'm going to challenge anybody, you'll see it. It's not you, right? I don't claim. It took me forever to figure this out, right? And I kept stumbling on it. But if we take a step back for any of this, right? Where's the value in AI, right? Oh, I hate reviewing this. I'm like, wait, take a step back. You're playing a huge role here. So,
Yeah.
whew,
I mean, my heart kind of goes a little bit. I think I like have heart palpitations when someone says I hate reviewing my own work, but at the
yeah,
same
right.
time I can understand that it's an extra time. Um, but um it please, if you have any ambient AI as a compliance quality individual that's worked in the healthcare, please review it, edit it, because then your edits then build the architecture for future improvements. Um, and that's one of the reasons why, yes, that time and devoting that time, as painful as it is to reading over, is so important. Um,
And then you're going to benefit from it sooner
yeah.
than later, by the way, too. It's
Oh
not,
yeah.
yeah, right. That's the other thing. You're going to benefit from it. And so put the work in on the front end. Um, and then watch the magic happen, right? Don't look at it as a task. Look at it, and then I love this because my goal is to get more of that stuff into the system so that on the front end, so by the time the ambient in the room kicks in, it's already filling some of those boxes so that the provider can see either before they walk in the room. I want them to see it before they walk in the room, obviously, but then we got to make sure it flows down and fills in, right? And where it
Hmm.
needs to when it's figuring out a plan and everything else, right?
Hmm.
Yeah. Cool. Whew,
Yeah.
I'm exhausted. How are you?
I'm I'm good. I'm good. I was like, man, well, I don't want to go down another rabbit hole, but I do. It's like
Well,
so.
I
It's
think
like,
I told you, right? And, let's get together again and let
yeah.
you and I debrief on some of these and we'll at least start there. You can't not go down these different directions because here we are, the complexity of people. The system does it. My tagged tweet for like the last 12 years is, right? We view people as simple and the process complex. I'm like, we got to flip that and understand, right? People are complex and the
Oh yeah.
system should be simpler. Healthcare, right?
Yeah.
That's been my tag tweet for like 12 years, right? And
Yeah.
that's what I constantly refer back to. So again, when we have this conversation, yeah, it needs to go many different directions. And by the way, someone's going to listen to this and grab certain parts, and I'm going to go, awesome, you heard what you needed to hear
Yeah.
in their journey.
That's all I can hope.
So
So
we're going to agree to meet again, and it doesn't have to be sooner than later. We're going to agree to move. And by the way, if we wait 2 months, we'll go, oh shit. If you guys listen to the old episode, none of it matters anymore. I'm
discount
just
the
kidding. I'm
discount the
just kidding.
all this stuff has changed. Oh
Yeah.
yeah, and it's been a this has been amazing. Thank you so much. I know it's like a hour and a half, and
Yeah. Well,
um,
I had a feeling, and that's why I wanted you to come on. And I was hoping, and then you made me think, God forbid. So some of that stuff, especially that middle part, I want people to go back in here. That whole part about that's really where I went. Yeah,
mhm,
PTs they have an obligation to feed the system and build the architect. I'm running with that. I'm going to post that today.
I love that. I love
Yeah,
that.
that's good stuff.
Um,
All right, don't hang up. I'm
I
going to
won't.
say thank you, and I hope everybody enjoyed this. And I'll have CJ back on soon, and God knows what rabbit hole we'll go down.